And so I'm going to tell you a little bit about the project that we've been working on to try to address the needs of people like Adam, wherever you are, Adam. And, we talk about prevention, and typically when we frame prevention, we frame it as wanting to reduce the risk of harm to victims. And of course, there are many compelling reasons to focus on the risk of harm to victims. You've heard about the increased risk that child sexual abuse engenders for serious mental health problems like PTSD and anxiety and depression. Victimization increases the risk for physical health problems like hypertension and cardiovascular disease. It's one of the ACEs, the adverse childhood events, that shortens the lifespan. That's associated with a shorter lifespan. Being abused actually increases your risk for sustaining subsequent abuse later in life, in adolescence and adulthood. Boys under the age of 18 account for anywhere from 36 to 50% of all perpetrators of child sexual abuse. So this is a teenage phenomenon. It's a child phenomenon. And boys who don't offend, but who find themselves attracted to young children, that's a small percentage. We don't believe there's very many people who are preferentially attracted to young children. But for those people who there are, and particularly for the adolescents, they suffer enormously. These quotes are from quotes from discussions I've had with the young men that Luke put me in touch with. These kids go through adolescence with its normal ups and downs, but with this awful internalization of the stigma of being a monster. There is a model for this in Germany. The Prevention Project Dunkelfeld has been going on since 2005. And this is a project that actively reaches out to people who are living with sexual attraction to children and who want help for it, including people who have and have not ever offended. Dunkelfeld means dark field, and they envision this attracting people who are living in the dark field, particularly those who have offended but who haven't been caught. But it also is for people who have not offended and who don't want to. As I said, we envision an intervention. It's not developed yet, but we envision an intervention that meets the needs of youth attracted to younger children and who are committed to not acting on those attractions. And we see two broad areas of intervention. First and foremost, to ensure that these young people have the tools and the skills and the wherewithal to keep themselves and others safe by not engaging young children in sexual behavior. And of equal importance is to ensure that they develop the self-respect and the self-esteem that characterizes healthy and productive young people. We envision kind of 4 steps to getting through to the end of an intervention that we hope we can make available one day. And the first is to start with interviews with people like Adam, who's a consultant on this project, and others, to talk about what would you have benefited from as an adolescent? What would have helped you stay safe and be happier and healthier? And before Luke introduced me to Adam and several other people who were part of Adam's self-help group, I had never spoken to someone who was attracted to children but who had not offended. All of my knowledge across 25 years was based on doing research and clinical work with people who came to me through the juvenile and the adult criminal justice systems, people who had been caught, people who had already decided to offend. And that's true for my field. Almost everything we know is based on the people who get caught. We have very little understanding of the scope of folks who are out there living with these afflictions, with these unwanted attractions, and not engaging in harmful behavior. So the first qualitative piece is actually, we're gearing up to get that underway. We have an institutional review board proposal. They have a few questions for us, 15 questions for us. So I'll be meeting with them in a couple weeks. But our institutional review board at IRB has been wonderfully helpful and strong partner in all of our research at the Moore Center. So I'm confident that we'll get through whatever the snags might be. And we also need to really carefully design the assessment and the intervention pieces and the materials that we will use for outreach. At present, this is an unfunded project. We're looking to partner with foundations. I don't believe at the moment a government funding agency that would be willing to tackle this particular problem, but a couple of foundations have reached out to us. Nobody's signed a check yet, but we're hopeful that we can get some funding to at least get us through the first couple of stages, and then we think if we've got a decent looking intervention with a little bit of feasibility behind it, we might be able to engage with some government funding agencies, and that's what it'll take. Feasibility studies are expensive, and randomized control trials are very expensive and unlikely to be funded without governmental support. I want to acknowledge the tremendous impact that Luke's reporting has had on this topic. He mentioned some of this, but I think it bears repeating. First of all, again, he really contributed just to my growth as a scientist and as a clinician by getting to meet and speak with now many, many people who are in the space of living with an attraction that they don't want and figuring out how to navigate it. He mentioned that millions of people have listened to the This American Life Help Wanted episode and read the Matter magazine article. He gets emails, hundreds of emails. I get hundreds of emails, phone calls, letters. Just the volume of the response is remarkable. I've been on NPR a few times, and PBS, and Radio Science, and some some shows with large audiences, and most I've ever gotten is one or two people ever reaching out to me in the past, and inevitably one of them supports whatever it was I said, and one of them hates it and is never going to fund NPR again or send PBS any money. And Luke mentioned the Moore Center and our work in the This American Life episode, and which is why people contact me. Maybe I've had 200 emails. We're actually tracking this, of course, because we're numbers people. And until recently, I could say that every single one of those had been positive.